Mental health is a topic that many men consider taboo. It's part of the reason why suicide rates among men are nearly 4 times higher than they are among women. In this segment of A Brighter Tomorrow, I spoke to an expert about why so many men struggle and a local man who shares his efforts to break the stigma surrounding mental health.
I didn't even recognize myself.
Brian Nooner knows what it's like to be at rock bottom.
I had an invisible weighted blanket on me. And that invisible blanket was so heavy, I just couldn't throw it off.
From KOMU 8 sports director to president of a local bank to working for Special Olympics Missouri, Nooner has seen success in several industries.
I'm an extrovert, or people that know me would say I'm an extrovert.
But that doesn't make him immune to mental health issues.
I kind of lost myself.
Suffering injuries from a fall and recovering during COVID-19 isolation knocked Nooner's world off its axis, trapping him in a darkness he couldn't pull himself out of.
I became an introvert.
Doctors diagnosed Nooner with anxiety and depression.
That really knocked me off balance.
A prognosis he didn't know how to navigate.
This is one of the things about men that they say is, we're stubborn, there can be shame associated with it. You don't want people to look at you different.
And Nooner is not alone.
Men were just supposed to kind of suck it up and just to move on.
That's what mental health expert Gary Lemke says many men experience.
One of the biggest hurdles is actually just them acknowledging that I have this issue and I want to deal with it.
After Nooner received his diagnoses, he slowly began to build Mental Health Huddle, a platform aimed at reaching others with similar experiences.
My goal is to increase awareness, help them put a face on somebody that they know or can relate to.
Nooner speaks to groups across the country about what he's gone through.
And I give the patient's point of view.
But getting to where he is today wasn't easy.
It's still not easy. I still deal with depression. I still deal with anxiety. But I have tools to manage it.
Nooner says taking the steps to get better takes work.
You got to work. You got to be willing to put in the work beneath the work.
But opening up about your struggles can close the door to letting those struggles control you.
You got to allow yourself to be vulnerable, and the people that really want to help you will. I'm just so grateful.
Mental Health Huddle is celebrating 1 year this month. To hear more of Brian's story, you can head to KOMU.com.